If you have a loved one that is possibly struggling with substance use disorder, let me tell you what some of the signs are that they may be using something they shouldn't be. Okay. This can come with any substance. Anybody could really get addicted to any substance and it can become out of control, right? It becomes chaotic, it disrupts their lifestyle. So when you notice somebody you love is spending way, way, way too much money, right? They never have money. They're always asking you or someone you love for money. They're always worried about money. And this could just be them spending. But a lot of times, if they're using substances, they're overspending and they're trying to get it back and they're going in a cycle. Another thing is things may come up missing. Okay, not everybody steals, but at times people do get desperate. So if you notice that like things are being misplaced or things are going missing or things that are of value, like you feel like they're being looked at or talked about more, or they're asking you, are you willing to sell this? Things of that sort, right? That's what starts to happen. So that's when somebody is usually pretty far into their substance use disorder. If you notice, they have very pinpoint pupils that you can barely see. Their eyes are glossy. They are beautiful and bright. That could be an opiate use disorder. Usually opiates are what cause constricted pupils. Now, when they're very dilated, they're big, their pupil takes up their entire eye. That usually is some sort of an upper or amphetamines or something that causes them to be stimulated, right? If you notice, they have excessive energy and they can't function when they don't have extensive energy, right? You see them sleeping for days, they're in a bad mood, they're depressed. Now suddenly they're up and they're awake and they're talkative and they're up all night. You know, that can be amphetamines, that can be cocaine. If you notice that they are psychically going through mental health, right? Like they're happy, they're very, very happy, or they're very, very low, one or the other. There's always these extremes of up and down. They act shameful. Sometimes they're very secretive and they don't want to tell you anything, right? But they act like they're upset and they want to tell you, but they don't. Okay? If you notice that they're going and taking drives constantly, usually that's because they're selling something or buying something from someone, which could be a substance, right? And you see this going on over the time where they need the car, they're taking the car, they're gone for hours or even just like 5 minutes at a time, but they keep coming back and leaving again. Their schedules don't match up with work. If you notice their schedule is off, they're coming home later or leaving earlier. You're noticing this too, right? They're sleeping more. They're sleeping less. They're eating nothing. They're eating a lot more. There are all these extremes that go into looking into the signs, right? And when you're looking at somebody, you notice their character is changing, right? They're not quite the person they normally are. And sometimes people can hold it together really well. You might just see subtle changes, but eventually those subtle changes usually form into bigger ones, right? Maybe they're just more impulsive. Maybe they're just not thinking as logically when it comes to decisions. Maybe they are less caring about you and the people they love, right? Because they can't focus on that right now. There are a lot of things that go into this. Maybe they don't respond quite the same way. Maybe they're not like interactive with you like they always had been in the past. You know, they're not answering calls, they're declining a lot, you know, or they're calling you and money is a topic of conversation every time they call you. Or maybe they're really, really sad because they're using and they want to get help and they don't know how, so they're constantly calling you and telling you they love you, you know. And that's normal for the most part, right? It is normal to have family members tell you they love you, but if it's out of their character, you can feel it. And what I mean by that is when somebody's using and they're depressed and they don't feel good and they know that they don't feel like it's right, right? You'll start to see changes in them. They'll start to look different. Their appearance will change. If they're using amphetamines, they may pick at their face. They may have more acne or even scars that show up. You know, if they're smoking, their complexion may change. Even if it's, you know, even if it's just something as simple as marijuana, people do become overly dependent on marijuana to function, which, you know, in that case, is it going to off them? No, but if it's laced, it could. And there are laced substances out there now. We have to be careful, guys. You know, people that use benzodiazepines, what do you think they do? They go and end up stealing from stores. They do stuff they don't even remember. They have blackouts. You know, are they dizzy? Are they going through symptoms of a possible overdose of a medication or illicit substance? You know, are they constantly not feeling good? And are they going through withdrawals? That's another thing. In the mornings, are they mean? Are they acting hungover? You know, if they're excessively drinking alcohol, do they act like they cannot function in the morning? Are they shaking? Do they have tremors? Do they feel in pain? Are they throwing up? Are they nauseous? Are they having loose stools? Are they, going through all these things remotely in intervals that seem routinely? Right? It could be weeks before they're sick, but say they run out and every Friday they get paid and the next Thursday they're completely out of money, so they're usually quite sick on those days, and you notice this is a pattern. And what can you do about it, right? So when you finally say, okay, I've had enough, I can tell this is happening, and you confront them and they don't admit it, what do? You have to set boundaries that you feel comfortable with. And that could be none. If you're not going to feel comfortable with setting boundaries, then I'm not going to tell you you have to, because you don't. It's not up to me. But at the end of the day, right, it is good to be compassionate. It is good to love them. It is good to talk to them. And they're probably not going to tell you right off the bat what's going on. But the more you kind of plant those seeds and try to be there for them, the more that may come out. And eventually they may want to do something about it. Now, when they do want to do something about it, how do you know you're going to help them in a positive way? You can ask them what they want to do, right? If they're looking for some form of treatment, not every treatment program's safe, right? We're looking at where they could end up in a very bad situation if they leave the state. And it depends on what state they're in, right? So there's a lot of different laws that are going into effect because of this, but we're also not quite on the good side of recovery at this point where every center is safe. Even Medicaid fraud goes on now. And what happens if they don't have insurance, right? Scholarships usually come with a price that isn't good. So we have to look into that as well. There is a lot of sides to recovery, but is there safe treatment programs? Absolutely. Usually it's local. Usually it's Medicaid based. And there's some insurance company that works with Medicaid if they don't have a higher income. Once you get into private centers, that's where it gets sticky. That's where you see a lot of fraud, a lot of, body brokering. And it's scary because if they reach out to somebody they see online, that could be a middleman or a body broker sharing their recovery story online, they don't know. They might reach out to that person instead of you. So it is good to tell your loved one there are dangers when looking for a recovery center. And if they feel they may need that type of thing, there are different types of resources. They don't have to go to treatment. You do not have to go to rehab to get clean or well. You don't have to. You can actually just go to meetings if you want. Tell them there is local meetings, AA or NA. There is Narcotics Anonymous, which is great for somebody who is in the middle of substance use and they're not, drinking. Now say they're drinking, they can go to AA. They can go to both if they're doing both. It doesn't matter, right? You're not going to be excluded. You can go. Yes, in AA they may give you a little bit of a hard time if you're from you're a narcotics user or something of that sort, but generally yes, they will let you in and they will love you and they will be compassionate and they can figure out the rules with that. There are open meetings where you can go with them, okay, and get them used to this so they can see if they like it. There are other types of recovery, like smart recovery. There is church programs where they can go through religious ceremonies. There's religious groups that go on all the time for people that are struggling with substance use disorder. There's a lot of options. So you're not just stuck with one. The problem is it looks like there isn't any. And here in our county, no, there isn't a lot of options. There is the process of maybe you go to treatment, maybe you go into a long-term program. We have a couple long-term programs in the area that are really good, and they are Medicaid based, and they seem to be okay and not be involved in anything that I would say is considered to be dangerous. We do have a pretty tight lock state of New York, so we luckily do have the upper hand on that. And then they get to go somewhere, say like a halfway house. Halfway houses can be really good for you. For me, a halfway house was beautiful and it helped me grow and it helped me learn how to be an adult and it gave me so much structure back to my life. And then you have, sober living homes or independent housing programs for people in recovery, and those can be really good too, or they can be a mess. You can go to one where everybody's using and it's a trap house and it's falling apart. Or you can go to one where everybody's trying to stay in recovery and they're going to meetings or they're working or they're in outpatient. Another thing is an outpatient program. Outpatient programs work as well. There are people that go to outpatient and never go to treatment. So you have options. Some people do it at home. It is possible. Is it hard? Yes. Is it hard to stay in the same area and continuously be around the same people? Absolutely. Going back home to the same people that you used around, even living in the same house you were in, can be really challenging for somebody who's in recovery. They may need to move, and you take you everywhere you go. But going to a different location, not for treatment, but in general, maybe in the area, maybe 50 miles away, something of that sort, can be helpful. Even being around other men or women in the program or just in recovery can be extremely helpful. Finding a good job or a good career can be extremely helpful. So there are options, and if they're dealing with dual diagnosis and mental health, that's where things get even stickier, because now we're talking dual diagnosis. So they will probably need a therapist or a counselor, and a lot of times therapy can be absolutely amazing. Therapy can be one of the biggest components to treatment that can help you significantly. And I noticed that with therapy was actually one of the best things I ever did for myself. And it worked on its own, right? I did everything else too. There's also Medicaid assisted treatment. They can get on medication so they don't go through withdrawals. Will there be a dependency to that medicine? Yes, most likely. But what's the trade-off? At the end of the day, medication assisted treatment can be life-saving. It can be the literal difference between life and death. And right now, medications are being pressed to look real. There is literal marijuana being laced on the streets. Drugs are being laced left and right. So at this point, I'm not going to say that having a dependency to a medication that a doctor gave you to deal with your substance abuse disorder is a bad thing, because it's not. It's harm reduction. Also, help them with harm reduction resources, right? Where they can get clean using devices, they can get help, they can get more resources basically guided to them, so that if they want to get a higher level of care, there's an option, and it's a safe one, right? There's programs where they literally sit there and just talk to them, right? Peer support programs. There's that too. So what are the signs? There's a million of them, right? But when they finally sit down and tell you they may want help, and you've decided whether you want to put boundaries down, what you want to do with it, it's never going to hurt to tell them they have options, right? Many options. And they may have to travel within the area for those options. But if they're willing to, get a Medicaid ride to go to, a clinic that does outpatient or something along those lines, there's so many people in recovery now that if they were willing to stretch their hand out a little farther, they would probably be able to get the help they need. And it does come with an inner decision that person has to be ready to make. And even if they're not, just planting the seed and talking about it can also be the difference between life and death. All right, I'm done. Goodbye.